Welcome to another Medvarsity Deep Dive. Today, we're going to be looking at pneumonia in children,
Oh, yeah.
and we have a lot to talk about.
It's a big topic.
Yeah, so let's just jump right in.
Sounds good.
So, could you remind us what pneumonia is?
Pneumonia is an inflammation or consolidation of the lungs.
Okay.
And it's specifically those tiny air sacs called alveoli that get filled with fluid. And that makes it much harder to breathe.
Okay, so it's the fluid in the lungs that's making it difficult to breathe.
Right.
Okay. And there are different types of pneumonia, right?
Yes, there are.
What are the ones we see most often in kids?
Well, the most common type is what we call community-acquired pneumonia.
Mm-hmm.
And this is the kind that kids pick up just in their everyday settings.
Okay,
So it's school, daycare, playing with friends. And then there's also something called nosocomial pneumonia,
Okay.
which develops in hospitals or healthcare facilities.
So that's acquired in the hospital,
Exactly.
which is kind of scary. You'd think the hospital would be the safest place.
Well, yeah, ideally. But hospitals are filled with sick people, and germs can spread easily.
Right.
And then especially for children with weakened immune systems, they can get something called opportunistic pneumonia.
Oh, so that's specifically for immunocompromised children.
Right.
So different types, different causes, I imagine,
Yeah,
and probably different severities.
absolutely.
Okay, so let's talk about the causes.
Sure.
What are the primary culprits behind pneumonia in children?
Viruses and bacteria are responsible for the vast majority of cases.
Okay.
Viral pneumonia actually accounts for about half of all pneumonia cases in children.
Wow, and are we talking about the common cold and flu viruses here?
Yeah, those are the ones.
Okay.
Viruses like RSV, influenza, adenovirus are often the main players. And sometimes viral pneumonia can develop as part of a larger infection, like measles.
So even what might seem like a simple cold can actually turn into something more serious.
Yeah, especially in younger children or those with underlying health conditions.
Oh, right.
And of course, we can't forget about bacterial pneumonia,
Yeah.
which makes up a significant portion of cases as well.
And is that typically more severe?
It can be.
Yeah.
Bacterial pneumonia can develop as a primary infection, or it can complicate a pre-existing viral infection.
So it can be secondary?
Right, and it often presents with a more sudden onset, higher fever, and just like a general feeling of being much sicker.
So how can you tell the difference between bacterial and viral pneumonia?
Well, it can be tricky because the symptoms often overlap,
Yeah.
but there are some key differences. Bacterial pneumonia tends to have a very sudden onset with rapid progression of symptoms like high fever, chills, difficulty breathing. Listening to their chest, you might hear crackling sounds.
Oh, okay.
And if you do a chest x-ray, you'd likely see dense patches in the lungs indicating those fluid-filled areas.
So that's how it would show up on an x-ray.
Exactly.
And what about viral pneumonia?
Viral pneumonia usually has a more gradual onset.
Okay.
The fever might not be as high, and the child might have other symptoms like a runny nose or cough.
So it might look more like a regular cold.
Right.
And then would the x-ray look different as well?
Yeah, you wouldn't see those dense patches like you do in bacterial pneumonia.
Oh, okay.
It would be a much more scattered pattern on the x-ray.
Got it.
So that can help differentiate.
So that's a crucial distinction to make for treatment,
Absolutely.
because you would need to use antibiotics for bacterial pneumonia.
Exactly. And if it's viral, antibiotics won't be effective at all.
Right.
So the focus would be more on supportive care to help the child manage their symptoms.
So fluids and rest.
Exactly.
That makes a lot of sense.
Yeah.
Now, some children just seem to get pneumonia over and over again.
Right.
What factors are at play for these kids that keep getting pneumonia?
There are many factors that can increase a child's susceptibility.
Okay.
Environmental factors play a significant role.
Like what?
Things like exposure to secondhand smoke or living in overcrowded conditions.
So their lungs are kind of constantly under attack.
In a way, yeah.
Okay.
And we can't underestimate the importance of nutrition.
Right.
Malnutrition, especially deficiencies in protein and vitamin A, can really weaken a child's immune system.
And make them more vulnerable to infections like pneumonia.
Exactly.
So a healthy diet isn't just about growth and development. It's also about fighting off illnesses.
It really is.
Okay, so environment and nutrition play a big role.
They do.
What else?
We also see recurrent pneumonia in children with certain medical conditions.
Oh, okay.
So things like cleft palate, gastroesophageal reflux, bulbar palsy can cause food or liquids to be inhaled into the lungs.
Oh, so they aspirate.
Right, and that can lead to aspiration pneumonia.
And I imagine that could happen again and again.
It can, yes.
So those anatomical issues can predispose a child to pneumonia.
Exactly,
Okay,
yeah.
what else?
Well, of course, children with compromised immune systems due to conditions like HIV/AIDS or those receiving immunosuppressive medications are also at a much higher risk for pneumonia. Children with chronic lung diseases like asthma, cystic fibrosis, and tuberculosis also face an increased risk.
Because their lungs are already working overtime.
Exactly.
Right.
And finally, prematurity and low birth weight are also significant risk factors.
Oh, right, because those babies have underdeveloped lungs.
Yes, and their immune systems are still developing.
So they're just more vulnerable overall.
Right.
Wow. It's heartbreaking to think about these tiny babies facing an uphill battle right from the start.
It is, yeah.
So we really need to do everything we can to protect children from this potentially serious illness.
I agree. It really is, yeah.
So what can parents and caregivers do? I mean, to minimize the risk of their child developing pneumonia?
Well, vaccinations are absolutely a cornerstone of prevention. It's like a shield protecting children from some of the most common and dangerous causes of pneumonia.
Which vaccines are we talking about specifically?
The pneumococcal conjugate vaccine, or PCV, is incredibly effective at preventing infections caused by Streptococcus pneumonia.
And that's one of the main causes of bacterial pneumonia.
Exactly.
Okay.
This vaccine has really been a game changer in reducing the incidence of severe pneumococcal disease, which includes pneumonia, meningitis, and sepsis.
Wow. So it covers a lot.
It does, yeah. And what else? Then there's the Hib vaccine,
Okay.
which protects against Haemophilus influenza type B, another bacteria that can cause serious infections, particularly in young children.
So these vaccines are like tiny warriors fighting off those bacterial invaders.
That's a good way to put it.
And we can't forget about the flu vaccine,
Right.
because influenza can lead to viral pneumonia.
Absolutely.
So getting the flu shot every year can help reduce a child's risk.
It really can.
It's amazing how these vaccines can target such specific threats.
It is. It's pretty incredible.
Yeah. So vaccines are obviously crucial.
Yeah.
But what about just everyday habits?
Right.
Do those play a role in prevention as well?
Oh, absolutely. Simple hygiene practices can go a long way in preventing the spread of germs.
Like hand washing.
Exactly. Frequent hand washing with soap and water is one of the most effective ways to prevent the spread of all sorts of infections, including pneumonia.
It's funny how something so simple can be so powerful.
Yeah, it really is.
It's easy to forget sometimes in our busy lives,
I know.
but it's really important.
It is, and don't forget about covering coughs and sneezes with a tissue or your elbow.
Right, contain those germs.
Exactly.
I've also heard that breastfeeding can offer some protection.
You're absolutely right.
Oh, good.
Breast milk contains antibodies and other immune-boosting components that can help protect infants from respiratory infections, including pneumonia.
So it's like nature's own defense system.
It really is. It's amazing.
Okay, so we've talked about vaccines, hygiene,
Right.
breastfeeding. But what about those broader environmental factors,
Right.
like secondhand smoke?
Yes. Secondhand smoke is a big one.
That's something parents really need to be aware of.
They do. Protecting children from secondhand smoke is crucial.
Yeah.
Not only does it protect them from the immediate effects of the smoke, but also from long-term damage it can cause to their developing lungs.
And on that note, it's also important to manage any underlying health conditions
Right.
that might increase a child's risk of pneumonia.
Absolutely.
So, for instance, if a child has asthma, keeping their asthma well controlled can help minimize the risk of getting pneumonia.
Precisely. It's about taking a holistic approach
Okay?
and addressing all the factors that might make a child more susceptible.
It's like building a fortress around their health,
I like that.
protecting them from all angles.
Yeah, that's a great analogy.
So while we're on the topic of protecting children, early detection is key.
Yes, absolutely.
If you notice any concerning symptoms in your child,
Right.
don't hesitate to seek medical attention.
I agree. Early intervention can make a world of difference.
Absolutely. So what symptoms should parents be on the lookout for?
Things like rapid breathing, a high fever, chest pain, or a persistent cough.
How do doctors determine if a child has pneumonia?
Well, the diagnostic process usually starts with a thorough medical history and physical exam.
Okay.
The doctor will ask about the child's symptoms, their overall health, any potential exposures to sick individuals.
Like putting together a puzzle.
Right, gathering all the pieces of information.
And then during the physical exam.
Yeah.
Yes, during the physical exam, the doctor will listen to the child's lungs,
Okay.
checking for any abnormal sounds like crackles or wheezing, and looking for any signs of respiratory distress.
So are there any specific tests that can confirm the diagnosis?
A chest X-ray is a standard diagnostic tool for pneumonia.
Wow.
It provides a visual snapshot of the lungs. allowing the doctors to see any inflammation or fluid buildup.
It's like taking a peek inside the lungs.
Exactly.
Wow.
Sometimes a blood test might be done to see if there's an infection and to determine whether it's bacterial or viral. And sometimes a sputum culture is done,
Okay.
where a sample of mucus coughed up from the lungs is analyzed to identify the specific bacteria causing the infection.
It's incredible how these tests can pinpoint the culprit.
It is, yeah.
What else?
Sometimes a pulse oximeter,
Okay.
which is a simple tool that clips onto a finger.
I've seen those.
Yeah.
They're painless.
Completely painless.
Okay, good.
It just measures the oxygen level in the blood. So it's a quick and easy way to check if the lungs are getting enough oxygen to the bloodstream.
So all these different tools work together to create a picture of what's happening.
Yeah, like assembling a puzzle.
Wow.
Using each test to fill in the gaps and arrive at an accurate diagnosis.
And once the diagnosis is made, the treatment plan can be tailored specifically to the child's needs.
Exactly. It's not a one-size-fits-all approach.
Right.
Every child is different, and their treatment should reflect that.
It's all about personalized medicine.
It is using the right tools and treatments for the individual patient.
So we've covered prevention, diagnosis, even touched on treatment. What else do we need to consider when it comes to pneumonia in children?
Well, it's important to remember that complications can arise,
Okay.
especially if the pneumonia is severe or not treated promptly.
What kind of complications are we talking about?
One serious complication is respiratory failure,
Okay.
where the lungs are no longer able to provide enough oxygen to the body.
That sounds really scary.
It can be, yeah.
So it can be life-threatening,
It can be life-threatening and often requires intensive care.
including being put on a ventilator.
Exactly, a ventilator to help the child breathe.
Wow. So prompt treatment is essential to prevent things from escalating to that point.
It really is.
What other complications can happen?
Another potential complication is sepsis,
Okay.
which occurs when the infection spreads from the lungs into the bloodstream.
So it's not just in the lungs anymore.
Right, it becomes a systemic infection affecting multiple organs.
Oh, wow.
And it requires aggressive treatment with antibiotics and supportive care.
So it can get really serious.
It can, yes.
What else?
Another possible complication is pleural effusion,
Okay.
which is a buildup of fluid around the lungs.
So the lungs are surrounded by fluid.
Yes, and this fluid buildup makes breathing even more difficult and might require drainage.
So those are some serious complications.
They are, yeah.
This has been a really comprehensive overview of pneumonia in children.
Yeah, we've covered a lot of ground.
We've explored the types, causes, risk factors, prevention strategies, diagnosis, treatment, and even potential complications.
It's a complex topic.
It is. What stands out to you most from all of this information?
For me, it's the realization that pneumonia is not just about germs.
Okay.
It's about the interplay of a child's environment,
Right.
their nutrition,
Mm-hmm.
their overall health,
Yeah.
and their access to healthcare.
It's all interconnected.
It really is.
It's a reminder that a child's well-being is influenced by so many different factors.
Absolutely.
Yeah, it really emphasizes that health is about so much more than just treating a disease.
Right.
It's about creating an environment where children can thrive
Yeah.
and their bodies have the best chance to fight off these infections.
I completely agree.
So what's the key takeaway here for parents and caregivers listening?
Well,
What steps can they take to protect their children from pneumonia?
the first step is awareness.
Okay.
Understanding the risk factors, recognizing those early warning signs,
Right.
that can make a huge difference. And secondly, take advantage of those preventative measures.
Okay.
Vaccinations, good hygiene, breastfeeding if possible,
Yeah.
and creating a smoke-free environment.
So even simple actions can really make a difference.
You really can.
Okay, and what if a parent is concerned? I mean, what should they do?
Never hesitate to seek medical attention. Early intervention can often prevent complications and lead to a much smoother recovery.
So trust your instincts.
Yeah,
And don't be afraid to advocate for your child.
exactly.
Well, I think we've given our listeners a really good understanding of pneumonia in children.
Yeah, I think so.
We've talked about the different types, causes, risk factors,
Mhm.
prevention, diagnosis, even potential
We've
complications.
got to read a lot.
We have, and we've also highlighted the importance of a holistic approach to a child's health,
Right?
recognizing that environment, nutrition, access to health care,
Yeah.
all of that plays a role.
It all ties together.
It really does.
It's all connected.
This has been a really insightful deep dive
It has.
into a condition that affects so many children.
And remember, our understanding of pneumonia is constantly evolving.
That's true.
As research advances, we'll continue to learn more and develop even more effective treatments and prevention strategies.
So keep those curious minds engaged.
Absolutely.
And stay tuned for more deep dives into the world of medicine and health.
That's good.
Until next time.